Neurosurgery is used to treat serious problems in the nervous system, from the brain and spine to the peripheral nerves. Dr. Daniel Nagasawa from Achieve Brain and Spine first outlines the education required to treat these complicated structures.
So a neurosurgeon is a doctor. They've gone through specialized training. So during residency, we focus specifically on disorders involving the brain and the spine. So we get 7 years of training in both of those. I did my neurosurgical residency over at UCLA, which had an excellent background in complex brain tumors, and I wanted to also subspecialize in complex spine disorders.
Dr. Nagasawa defines what a brain tumor is and the possible symptoms.
So a brain tumor is a mass of abnormal cells that are rapidly dividing uncontrollably. The symptom of a brain tumor may vary depending upon a number of different factors, the main one being the location of the brain tumor and the size of the brain tumor. Most common presentations are things like headaches or even seizures. Other symptoms can involve weakness, numbness, nausea, vomiting, everything up to complete loss of consciousness.
The diagnosis will determine how the brain tumor is treated.
Diagnosis of a brain tumor is most commonly initially found on a CT scan or a CAT scan, and then more accurately depicted upon MRI to get a higher resolution. The treatment for a brain tumor depends upon a number of factors as well. The location of the brain tumor, as well as the presumed specific type of brain tumor that it is. Treatment may involve conservative management, meaning serial scans, watching and waiting if there are no specific symptoms involved with the brain tumor, or it could be a biopsy to see exactly what type of brain tumor it is, a surgical resection. You could also do some chemotherapy or radiation, again, all depending upon the type and location of these tumors.
Compassionate, precise care is resulting in positive outcomes for patients.
I approach every patient interaction as if I would with any member of my own family, so that I know they're going to get the greatest care possible, that they're going to get the right diagnosis and then the right treatment for that. We try to do conservative management first, and if they have severe pain, weakness, or concern for impending neurological deficit, then we progress more quickly to surgical intervention. Historically, when someone was diagnosed with a malignant brain tumor, prognosis was poor. But with recent advancements in surgical technique, chemotherapies, and radiation, patients can live decades.
Dr. Nagasawa discusses his relationship with Dr. Khosla.
Dr. Khosla and I met when I was doing my residency training. I did a rotation over at Kaiser where he was working at the time. And during that process, I got to know him very well. He and I both had similar perspectives in terms of how patients should be cared for, the humanity and the empathy that should be expressed with them, and that first and foremost, it's patients first. When he decided to start a new company, he wanted me to come on board as his partner to help create Achieve Brain and Spine, again with the focus being on our patients and trying to provide excellent care. Dr. Khosla has been in practice for a number of years now, and so what comes with that is a lot of experience. And whenever there's difficult cases, we can run it by each other and get a different perspective. And so your approach can be different depending upon your training background and the desired goal. And so we feed off of each other, both ideas, and then we operate together in the operating room, assisting one another on complex cases so that we can provide the greatest patient care possible.
Dedication to patients extends to making treatment available to people that may be financially unable to get the medical help they need.
So when we started Achieve Brain and Spine, one of our primary goals was to be here for our community, to be able to support them, and not just the people who are able to come in with a bag of money and offer us that for surgery, but for the people who sometimes don't have any insurance or have lesser insurance. They deserve excellent health care, excellent neurosurgical care, just like everybody else. So with us, nobody is turned away. We don't want anybody to have to worry about how they're going to afford to get better. We want them just to focus on healing. And so that's why we decided to be in network with essentially every insurance carrier, so that everybody can have that hope that they're going to be able to get better and receive the care they deserve.